The first action after accidentally puncturing your finger with a used needle is to A. Cover the wound with tape immediately. B. Wash the area with soap and water. C. Apply alcohol and continue work. D. Report it at the end of the shift. Answer: B. Immediate washing minimizes pathogen entry, reporting follows after cleaning. The OSHA bloodborne pathogen standard primarily protects workers from A. Bacterial infections. B. Viral bloodborne pathogens like HBV and HIV. C. Environmental contamination. D. Radiation exposure. Answer: B. The standard safeguards healthcare workers against exposure to bloodborne viruses. Phlebotomists should avoid recapping used needles because it A. Increases blood waste. B. Causes delayed disposal. C. Raises risk of accidental needle stick. D. Decreases tube stability. Answer: C. Recapping is a leading cause of needle stick injuries. Immediate disposal is mandatory. The sharps container must be replaced when it is A. Half full. B. 3/4 full. C. Completely full. D. Leaking only. Answer: B. Containers should be replaced at 3/4 capacity to prevent overfilling and accidental injury. The correct sequence for removing PPE is A. Gloves, gown, mask. B. Gown, gloves, mask. C. Mask, gloves, gown. D. Gloves, mask, gown. Answer: A. Gloves are removed first to prevent contamination transfer, mask is last to avoid inhalation exposure. When labeling blood specimens, phlebotomists must wear A. Sterile gloves only. B. Fresh gloves after collection. C. Same gloves used for draw. D. No gloves if tube is closed. Answer: B. Gloves contaminated during venipuncture must be changed before labeling to maintain cleanliness. The first step in any exposure control plan is A. Incident reporting. B. Exposure assessment. C. Immediate washing and first aid. D. Supervisor notification. Answer: C. Physical decontamination precedes administrative steps in post-exposure protocol. The main reason phlebotomists should avoid eating or drinking in collection areas is A. To maintain appearance. B. To prevent sample mix-up. C. To prevent accidental ingestion of contaminants. D. To follow dietary rules. Answer: C. Biological materials in lab areas can aerosolize. Ingestion poses infection risk. The most effective method to reduce pathogen transmission is A. Mask wearing. B. Hand hygiene. C. PPE usage. D. Double gloving. Answer: B. Hand washing or sanitization removes pathogens most effectively after patient contact. After a specimen spill, the surface should first be A. Dried immediately. B. Covered with paper towels soaked in disinfectant. C. Cleaned with water. D. Left to air dry. Answer: B. Disinfectant-soaked towels neutralize pathogens before wiping to avoid aerosol spread. Safety-engineered needles are designed to A. Reduce patient pain. B. Prevent backflow of blood. C. Minimize needle stick injuries. D. Increase sample flow. Answer: C. Safety needles include shields or retractable tips to prevent accidental sticks. The proper way to handle an unlabeled tube found in a tray is to A. Label it using nearby forms. B. Discard it immediately. C. Ask a colleague to identify. D. Send it for testing anyway. Answer B. Unlabeled samples are invalid and must be safely discarded to prevent identification errors. When transporting specimens, tubes should be placed in A. A sealed secondary biohazard bag. B. An open tray. C. The phlebotomist's pocket. D. A paper envelope. Answer A. Secondary biohazard bags prevent leakage and cross-contamination during transport. The color symbol for biohazard waste is A. Blue. B. Red or orange. C. Green. D. Yellow. Answer B. Red or orange containers identify biohazardous materials in healthcare facilities. Before performing any venipuncture, a phlebotomist should review A. Facility fire map. B. Exposure control plan. C. Patient diet chart. D. Shift schedule. Answer B. Awareness of the exposure control plan ensures preparedness in emergencies. When collecting blood from a patient in isolation, phlebotomists should A. Use the same tourniquet for multiple patients. B. Bring only required supplies into the room. C. Remove PPE before leaving. D. Reuse gloves for next patient. Answer B. Bringing minimal supplies reduces contamination risks and waste. A safety data sheet, SDS, provides A. Chemical handling and spill response information. B. Patient care instructions. C. Collection site details. D. Blood labeling guidelines. Answer A. SDS contains information on hazards, storage, and spill management for chemicals. Gloves must be changed. A. Every 30 minutes. B. Between every patient. C. Only if torn. D. After 5 patients. Answer B. Single-use gloves prevent cross-contamination between patients. The most common cause of workplace injury among phlebotomists is A. Slips and falls. B. Needlestick incidents. C. Glass breakage. D. Burn injuries. Answer B. Needlestick injuries remain the leading cause of occupational exposure to infection. The correct response to a fire in a collection area follows the RACE acronym, meaning A. Remove, alert, contain, evacuate. B. React, assess, contain, extinguish. C. Run, alarm, control, evacuate. D. Remain, alert, control, escape. Answer A. RACE outlines the standard fire emergency sequence in healthcare safety training. When disposing of broken glass contaminated with blood, use A. Paper towel. B. Sharps container. C. Standard trash bag. D. Recycle bin. Answer B. Contaminated glass is treated as sharps to prevent cuts and exposure. The maximum time a tourniquet should remain on is A. 30 seconds. B. 1 minute. C. 2 minutes. D. 3 minutes. Answer B. Longer duration causes hemoconcentration and tissue damage. If a phlebotomist's gloves tear mid-procedure, they should A. Ignore if minimal. B. Stop, replace gloves, and resume safely. C. Continue without interruption. D. Add another layer. Answer B. Immediate glove replacement prevents direct exposure to blood. The appropriate disinfectant for blood spills is A. Soap and warm water. B. 10% sodium hypochlorite solution. C. Alcohol wipes. D. Hydrogen peroxide. Answer B. Bleach solution effectively kills bloodborne pathogens like HIV and HBV. A phlebotomist experiences dizziness from chemical fumes. The first step is to A. Continue working. B. Move to fresh air immediately. C. Drink water. D. Sit down and rest in lab. Answer B. Leaving the contaminated area ensures safety from inhalation hazards. A lab coat contaminated with blood should be A. Washed at home. B. Discarded in a biohazard laundry bin. C. Rinsed in sink. D. Dried and reused. Answer B. Blood-soiled garments require professional laundering under biohazard protocols. During a power outage, specimens should be A. Left on bench. B. Placed in designated emergency refrigerator. C. Returned to patients. D. Stored at room temperature indefinitely. Answer B. Refrigeration prevents hemolysis and degradation during extended outages. Hands should be washed with soap and water instead of sanitizer when A. Between patient draws. B. Visibly soiled or contaminated. C. Leaving the lab. D. Wearing gloves. Answer B. Sanitizers are ineffective against visible organic material. Phlebotomy trays should be disinfected. A. Once a week. B. Before each shift and after contamination. C. Only if visibly dirty. D. Monthly. Answer B. Regular disinfection prevents cross-contamination between patients. The most appropriate footwear for a phlebotomist is A. Open-toe sandals. B. Cloth sneakers. C. Closed, non-slip shoes. D. Plastic slippers. Answer C. Closed shoes protect against sharps, spills, and slips. After centrifugation, if a tube leaks, the phlebotomist must A. Clean the centrifuge with bleach. B. Continue using machine. C. Notify housekeeping only. D. Ignore minor spills. Answer A. Blood leakage contaminates surfaces, bleach ensures pathogen elimination. If a patient with TB coughs during collection, the phlebotomist should A. Ignore and proceed. B. Leave and allow ventilation before resuming. C. Turn away briefly. D. Ask patient to cover mouth only. Answer B. Airborne particles remain suspended, ventilation prevents transmission. When working with pediatric patients, safety protocols require A. Using adult-sized needles. B. Using only safety-engineered devices. C. Skipping gloves if minimal blood. D. Avoiding labeling at bedside. Answer B. Pediatric draws demand smaller, safety-equipped tools to prevent accidental injuries. Blood samples for cross-match must be labeled with A. Initials only. B. Full name, DOB, and collector's ID. C. Test code only. D. Room number. Answer B. Full identification prevents fatal transfusion mismatches. Before using a centrifuge, phlebotomists should check for A. Tube color. B. Proper balancing. C. Tube labeling. D. Volume consistency. Answer B. Unbalanced loads cause equipment damage and sample breakage. In case of an electrical shock from equipment, the first step is to A. Pull the victim away immediately. B. Turn off the power source. C. Call housekeeping. D. Use metal tools to assist. Answer B. Disconnecting power ensures rescuer safety before providing aid. When preparing to ship biological specimens, phlebotomists must A. Seal only primary containers. B. Follow triple packaging standard. C. Label as urgent mail. D. Use paper envelopes. Answer B. Triple packaging ensures containment of biohazards during transport. The correct response to a small lab fire caused by alcohol is to A. Pour water over it. B. Use CO2 or dry chemical extinguisher. C. Open windows. D. Smother with paper towels. Answer B. Alcohol fires require Class B extinguishers, never water. Hands should be washed for at least A. 10 seconds. B. 15 seconds. C. 20 seconds. D. 30 seconds. Answer C. CDC recommends 20 seconds of friction to effectively remove pathogens. To ensure safety during venipuncture, the phlebotomist should always A. Recap needle before disposal. B. Engage safety device immediately after withdrawal. C. Dispose of used needle later. D. Leave needle on tray until end of shift. Answer B. Activating the safety device immediately eliminates post-draw exposure risk.